So we're right at 2 o'clock. Welcome everyone. Thank you so much for joining this webinar. Today you'll be presented with some very great information. My name is Adrienne Coleman. I'm with Addiction Prevention Correlation. Welcome all our members as well, all the participants. And we'll be having a webinar on vaping today. And there will be lots of great information again. And we have a question and answer section down there at the bottom. So we have a very special guest from UAB, Go Blazers, that'll be giving the presentation today. So you can put your questions in that little question and answer box, and we'll go over those after she completes her presentation. Without further ado, our actual speaker today is Dr. Susan Wiley. She is the professor of pediatrics in the UAB School of Medicine and works as the pediatric hospitalist at Children's of Alabama. She is the medical director of UAB Tobacco Consult Services and principal investigator of the Birmingham Youth Tobacco Prevention Program. Her research and advocacy interests include developing strategies to protect youth from tobacco use and tobacco smoke exposures. Additional topics covered for Dr. Wiley, it'll just be a presentation on the tobacco products, and she has great demonstrations and everything. So I'll go ahead and turn it over to Dr. Wiley, and you can begin sharing.
Thank you, Adrienne, so much.
You're welcome.
Let me share my screen, everybody. Can you see that? Give me a thumbs up, Adrienne. Is that showing up for you guys? Okay, great. Well, I wish I could be with you guys in person. As Adrienne kind of mentioned, I have some show and tell, and we'll see if you can see that over the camera. But we all know right now we are certainly in a pandemic, a public health crisis with COVID. But I want to keep everybody's kind of eye on the fact that we also have a youth vaping epidemic. And, you know, through the past few decades, in terms of public health and you guys as advocates, you know, for addiction and substance use, you know, we've been able to make some really good progress in cigarette use throughout our country, in both decreasing use in adults and children. But unfortunately with e-cigarettes, and you'll kind of see some of the marketing and advertising, as well as some of these deceptive tactics with use of flavors and things, you know, we're seeing a really huge rise, or have seen a really huge rise in youth use of these tobacco products, because e-cigarettes are a tobacco product. And we are very concerned that COVID, if anything, is making this worse. So we'll just jump right in. And let's see if we can get the slides to move forward. They're not wanting to for some reason. Let me see if I can do this manually, guys. Sorry. Oh, here we go. So, you know, the three major points, I know there's a lot of information that we're going to cover, but, you know, the first main one is that e-cigarettes are the most common tobacco product used by youth. And the major point there is, you know, as you can see, that this is from the CDC, Centers for Disease Control. So in 2019, 30% of youth, of high school students, are using a tobacco product. And of that, 28%, 27.5% are using e-cigarettes. So, you know, far and away, that is the most common tobacco product. And it's really important. I know that there's a lot of false messages out there, you know, that say that e-cigarettes and vaping, because I'm using those interchangeably, those terms, that e-cigarettes are not tobacco products. And I think it's really important for all of us to remember they are tobacco products, and they're subject to the same regulation as other tobacco products, such as cigarettes. You can also see in this graph that, you know, we haven't won the battle on other tobacco products. So 7.6% of kids are using cigars. And I know, you know, for a lot of people who aren't that familiar with tobacco products, are like, you know, cigars, that's just for, older, rich people. But unfortunately, cigars, or cigarillos, as they're probably more correctly named, have a lot of uptick in the youth because they're not subject to a lot of the same regulation as cigarettes, and they're sold in packs of 1 and 2, sometimes for 99 cents, and they're also in flavors. You can see cigarettes are at about 6% of high school students. Smokeless tobacco, particularly in rural white boys, is certainly still an issue that we're seeing. So, and this is just the same information, but just over the past few years. So you can see in 2011, this red bar is high school student e-cigarette use. And you can see how it just really dramatically has gone up, particularly in the past 2 years. And when you ask, like, what's the reason for that? This is the major reason. Hopefully everybody has heard about Juul. Juul is what we call a pod-based e-cigarette. It's oftentimes, I kind of describe it as the e-cigarette of the iPhone of e-cigarettes, because the technology is really advanced, and you can see some of the marketing that that is very colorful and attracts kids to use. So what exactly is Juul? So one of the most important things to know is that Juul has the majority of the market share right now of e-cigarette products. Now that may have changed with some regulation that the federal government has, but it's still certainly one of the most common products, e-cigarette products, that youth are using. So, if you ask, and I have been guilty of this when I, as a pediatrician, ask kids, do you use e-cigarettes or do you vape? And they say no. And then you go back and you say, do you Juul? And they're like, oh yeah, I Juul. So kids don't necessarily view these products as e-cigarettes, these Juul. So Juul uses these pods, and I have one right here. So you can see that it's very small, very easily hidden in a pocket or down somebody's sleeve, and they use these little cartridges that have these tops, these plastic tops. So oftentimes, you'll see a parent say, I'm finding these little plastic tops, in the trash or, just around the house. And that is kind of a telltale sign that at least somebody, maybe not the child, has been using these Juuls. Each of these tiny pods is equivalent to about 1 pack of cigarettes, 20 cigarettes. So because the fluid, the liquid in this cartridge, which I know you probably can't see, has a very, very concentrated nicotine. It's 59 milligrams per milliliter. And I think another really important point for everybody to know is that Juul is owned by Big Tobacco now. So it was purchased in 2018. Just a 35% stake was $13 billion, guys. So we're talking about big money here. So you already saw how Juul is advertising, and unfortunately other e-cigarette companies are getting into this, this space. So this is a brand called Puff Bar, which is getting really popular. It's actually a disposable e-cigarette, and this is so egregious that I really couldn't help but sharing it. So this says solo break. We know that the inside vibes have been quite a challenge. Stay sane with Puff Bar this solo break. We know you'll love it. It's the perfect escape from the back-to-back Zoom calls, parental texts, and work from home stress. So, I don't know of any 30-year-olds that live at home and have problems with parental texts. So, just when you look at the marketing and, the colors, and then you see this advertisement, it's quite clear that they are targeting our youth. And I think everybody on this call knows that, formerly cigarettes, but now e-cigarettes, are kind of that gateway to the next step. Almost nobody starts with cocaine as their first drug of choice. They start with tobacco, then it goes to marijuana. And so we really know for so many reasons that we have to prevent kids from use of this addictive product, which is nicotine. So the other reason for this huge uptick in e-cigarette use is that e-cigarettes are sold everywhere. I think everybody is kind of aware of the vape shops, and there's a lot of notoriety around that. But most kids who are purchasing e-cigarettes are getting it from the corner drugstore, gas station. This is actually a picture of what we call the power wall, which tobacco companies spend most of their advertising dollars on point of sale, which means like at the place that you buy the product. And this is what you will see, what any kid will see when they go to the counter to buy, their Gatorade or soda or whatever. And this is what they see. And it's a little bit tough to tell, but, about 1/5 of this wall, which happens to be the closest gas station to my high school that my kids go to, is devoted to e-cigarettes. And it's, it's very concerning that kids have this easy access. Now, the legal age of purchase in Alabama, formal to the federal Tobacco 21 law, was 19. But we know, unfortunately, that enforcement, there are opportunities with enforcement. So we'll kind of get into that a little bit as we talk about advocacy and what things that we can be doing as a group. So, and then lastly, in terms of this huge uptick in kids using e-cigarettes, is that, in 2009, flavors were deemed illegal in regular cigarettes, except for menthol and the tobacco flavor, because we knew that flavors, or we know that flavors attract kids. But now we have things like, this looks exactly like Sour Patch Kids. This is Cookie Twist. These are, really made not for a middle-aged woman like myself, but to attract a middle school or high school kid. So, the first major take-home point is, e-cigarettes are the most common tobacco product, and why that is, again, is that easy access, flavors, and then that they have, marketing and advertising that is geared to kids. The next really main point is that we know that using e-cigarettes, as well as the secondhand aerosol exposure, is not safe. So just like cigarettes have secondhand smoke, e-cigarettes have secondhand aerosol. And that's really important for all of us to know when we think about, comprehensive indoor smoke bans. You don't want people vaping in, the table at the restaurant right next to you, because there is that secondhand aerosol. There was a lot of media attention to EVALI in this past fall, which is e-cigarette or vaping use associated lung injury. And basically, at this point, we know that at least, almost 3,000 hospitalized cases and 68 deaths have occurred. Obviously, COVID has kind of kept the CDC's attention to something different, but it is still something. Actually, a patient at Children's just recently had EVALI, something that we need to be really worried about. And although they did end up, the CDC, identifying or thinking that vitamin E acetate was one of the major players, they don't know at this point, what was in e-cigarettes or what is in e-cigarettes that can cause EVALI. But what we do know is that many of the components in e-cigarettes are similar to the toxins found in cigarettes. And we know that those cause respiratory irritation and respiratory damage, lung damage. And so even if we're not talking about EVALI and people dying, we know that e-cigarette use is not safe. And so why is that? So right now, unfortunately, we're in a period where there is still limited regulation by the Food and Drug Administration that has authority over e-cigarettes in terms of what's in them. So when you purchase either Juul or some of these liquids, they will advertise what they have in them. And generally what they advertise is humectants, which is vegetable glycerin or propylene glycol. Those are both ingredients that are generally recognized as safe for ingestion. So they're found in cookies, they're found in a lot of cosmetics, but we do not have any long-term studies of what it does when somebody is inhaling it over time. So again, the products will say they have humectants, they say they have flavorings, which we know certainly can have some negative health effects, and then they say that they have nicotine. There are products, just so you know, that say that there is no nicotine in them, and then scientists have done studies and found nicotine in the products when they say they don't have them. So certainly nicotine, as we know, is the psychoactive ingredient found in tobacco products that make it addictive. But we also, unfortunately, as you can see in this CDC graphic, know that there are lots of other toxins and other ingredients that they don't advertise that you don't want in your body. Things like, metallic particles, nanoparticles, because the e-cigarettes themselves, they take the liquid and they heat it up, and they heat it with a metal coil, and that metal coil can degrade. And so we found things like nickel, tin, lead in the e-cigarette aerosol. We found carcinogens, cancer-causing agents. And, because we know that the nicotine is found in e-cigarettes is from the tobacco plant, it makes a lot of sense that we're finding a lot of those same cancer-causing agents in cigarettes we also see in e-cigarettes. So, again, lots of other ingredients in e-cigarettes that we know are dangerous for health. And then, I think it's really important to make sure that we continue to really stress the lung irritation and lung damage with vaping. Right now, we have evidence that when you smoke cigarettes, you double the risk of developing severe COVID-19 outcomes and death. So that's one of the only modifiable risk factors, because we know that older people are at risk for COVID-19. Well, you can't change your age, but smoking is a really important risk factor. Now, we don't have the evidence right now to say that, if you vape, you're also at higher risk, but scientists are concerned because think about it, vaping, you're doing a lot of hand to mouth, which we know is certainly a risk factor for contracting COVID. And then when we know that, vaping and using e-cigarettes can damage the lung, it makes sense that there's concern about COVID-19 and worse outcomes. So, definitely I think that, one of my messages as a doctor is that, if you need another reason to quit right now, think about COVID-19. All right, and then I think that, just to bring up, because, certainly a lot of the e-cigarette companies have put out incorrect messages. E-cigarettes are not an FDA, a Food and Drug Administration approved smoking cessation device. And so the National Academy of Science, who is one of the overarching scientific bodies, they are also saying these are not products that we should be using as smoking cessation devices. We have things that work, which is things like nicotine replacement therapy, like a nicotine patch and a nicotine gum. Those are what we should be recommending to people to use who want to quit smoking. All right, and so kind of the last major point is that we have sufficient data over time when we look at youth, children that are using e-cigarettes, to know that it's associated, when you look at a year out or 5 years out, that they are more likely to go on to conventional cigarette, like traditional cigarette use, as well as other substances of abuse. And I think that is why this message really ties in so well to the Addiction Prevention Coalition and what you guys are all doing. So, we think of, that gateway theory where, not only is it, for example, when you use a regular cigarette, that, it's just inherent to think that, if a youth is going to try cigarettes, they may be more likely to try marijuana. But I also want to make sure that, we also are aware that, use of nicotine, particularly use younger and heavier use, we think actually changes the brain chemistry and potentially can make you more likely for nicotine to to be a gateway to other drugs. And so I just want to be really clear that the picture that you see there is not an e-cigarette, it's of a youth dabbing. And I know that oftentimes, there's questions about dabbing and questions about marijuana. So did want to just mention that. Dabbing is when you take THC or you take marijuana and you prepare it in a way that you actually get an oil and it's generally of the THC, of the tetrahydrocannabinoids, which is the psychoactive part of marijuana. And people will, what you call dab, where they'll take that oil, put it on a nail, heat it, and then inhale it. So it's a way, it's not an e-cigarette per se, but it's a way of using marijuana, and particularly a very high strength THC. But adolescents who use e-cigarettes have been found in multiple studies to, again, go on to smoke cigarettes, even if they are not kind of the bad kids that you now kind of think about as smoking cigarettes. Also, they're more likely to binge alcohol, use marijuana, other illicit drugs, and we know that there are a lot of co-use. And the study that I have listed says about 9%, but there have been studies that have said that kids who are using e-cigarettes, even 30% of them say they have used marijuana in their e-cigarettes. So that's, of course, of big concern when we think longer term. So what are the things that we can be doing and we can be sharing with parents and sharing with teachers and, other community members and community leaders? Well, probably one of the biggest things, which, I'm a parent of 3 boys, that oftentimes really is hard, is you want to model the behavior that you want to see. So certainly, when, kids are seeing adults using tobacco, including cigarettes, including e-cigarettes, I think that sets a stage for them thinking that it's okay. We do know that kids who have parents or siblings that smoke cigarettes are more likely to use. So that's why, even though I'm a pediatrician and kind of started in this area thinking, how can I help kids? That's why I really have expanded to let's help adults either quit smoking or just not start using at all. We know actually that if you are 21 years of age and you don't smoke, generally the chance of you starting smoking is very, very low. So if we can get these kids, to 21 not having experimented, then the chance is that they're going to live a tobacco-free life. Second thing is that we need to be talking to teens. And I think this group knows, that you have to be honest and talk to them about, Juul and e-cigarettes. If you tell them the truth, it's not going to, make them all of a sudden realize that these things exist and more likely to try. And then another is be very clear that we do not recommend e-cigarettes or vaping. And, from a policy and an advocacy perspective, I think that in Alabama, it's important to know that only 12% of Alabamians are protected by comprehensive indoor smoking bans. We need a comprehensive statewide ban on smoking and vaping. And so those are things that we know protect people and protect populations and also decrease the smoking rates. The second is to ban flavors. You can see, unfortunately, that, we've already kind of shown you some examples, but this top is vanilla, and you can see that it really looks like the food product. And there's a lot of examples out there. As I said, there's about 15,000 different e-cigarette flavors. And then, thankfully, in December of 2019, Congress passed Tobacco 21, which means that you have to be 21 years of age to purchase, or let me flip that around, because we want the impetus, or we want the major person responsible to be the seller. So it's illegal to sell tobacco to individuals who are less than 21 years of age, but certainly enforcement is something that there's a big opportunity for still. So if there is a tobacco user in your life, the 1-800-QUIT-NOW line, quitnowalabama.com, is a fantastic resource. It will actually address vaping and smokeless tobacco to anyone 13 years or older. And so Alabama actually is very lucky that it has such a great quit line. And then there are so many wonderful community organizations. And if there is interest, please let me know. And I have my email on this last slide. And then lastly, I want to definitely give credit to Shelby Kyle, who is the program manager for the Youth Tobacco Prevention Program, the Birmingham Youth Tobacco Prevention Program. And Shelby, if you want to put this in the chat box, but she created this Takedown Tobacco Alabama website that talks about tobacco use. There have been a lot of teachers that have utilized this for their classes, for education, and it also has something specific with vaping and then also with COVID. So here is my contact as well as Shelby's, and I really just appreciate so much what everybody on this call is doing out there, and also, you know, just very happy to take questions and engage more with you. So thank you very much, Adrienne.
Thank you, Dr. Wiley. So much informative information. I have questions, but you've answered about 3 of my questions with your presentation. That was just so awesome. And so one of the questions was, will this webinar be available? And it will be available on our website, Addiction Prevention Coalition, on our Facebook page, as well as we'll add the link that Shelby put in the chat to the webpage so that they can, you know, if they had any questions after the presentation. But I wanted to know, Dr. Wiley, is it easy to tell if someone is vaping without them telling you, you know, is there signs, or, you know, or without any tests of, you know, their lungs or anything?
Sure. I think that is a great question, and one that we get a lot from parents and teachers. You know, the really big challenge, and I actually have several of these products here in front of me, is, you know, in the old days, you know, you see a cigarette, it's very recognizable. You smell the smell, it's very recognizable. Nowadays, though, you know, a parent, like, you know, sees this, or a teacher sees this, it's not obvious that this is an e-cigarette. And the smell that comes out of these products could be mango, it could be mint. You know, so I've heard teachers say like, oh, well, I smelled something, but they said it was their mango lotion. So it is really challenging. I think with Juul, again, you know, these plastic pod caps are really a very kind of telltale sign. And then one of the other things that I hear over and over again from parents and teachers is that this is the USB port in order to charge the Juul. And they'll say, oh my gosh, I saw this in my computer, you know, and I didn't realize that that was what it was. But, you know, just like any other addiction, and I know you guys know this, but, you know, if you're seeing, you know, changes in behavior, your kids are hanging out with different kids than they normally were, their grades are going down, you know, you're seeing that there's money that, you know, is missing. You know, those are all things that, you know, you want to really take seriously. So no easy answer, I guess, but there are definitely some telltale signs.
Okay. So is it easy for them to quit vaping or juuling, you know, versus smoking if they were smoking? What's that process if, you know, we find out that that's going on, I need to seek help, or can I just say stop doing it? You know, what's
Right. No, that is a very, very, very good question. And, you know, certainly could be a complete separate talk. So the short answer is, unfortunately, you know, oftentimes by the time parents or teachers recognize that somebody is juuling or using e-cigarettes, that child is addicted. And, you know, we've heard anecdotal stories about kids using even 3 of these Juul pods a day. And as I said, one of these is equivalent to 1 pack of cigarettes. And unfortunately, you know, of course, I didn't have time to get into this. We know that youth, because the brain is not mature, the brain really doesn't mature fully until 25 years of age, that they are more likely to become addicted to nicotine, even with intermittent experimental use. So, you know, the child that may be just using Juul, you know, on the weekends, and you think, oh, well, they're just experimenting. What we're seeing is that they go from experimentation to dependency to addiction very, very quickly, especially because these products have such high nicotine concentrations. So no, it is, you know, we have definitely seen as a pediatrician, you know, kids who want to quit, parents who are, you know, supportive and helping them, that have a lot of problems quitting. So definitely I would take your child in to see their doctor, because, you know, some of the therapies and some of the medications like nicotine patches and gum that have been used for smoking, you know, have been used for e-cigarette quitting. Now, I do want to also let you know, though, that none of those at this point are FDA approved. But if your pediatrician determines that, you know, a child is addicted, they can write a prescription for some of these medications.
Okay. We have a question. They want to know, can you speak to how vaping affects children or adolescents who take psychotropic medications that affects anxiety and the depression?
You know, that's such a broad topic, but a great point. So hopefully, and maybe that person could clarify a little bit. We do know, particularly in the adult population, that a lot of adults, you know, will perceive that smoking calms their nerves. And in fact, what is really happening is that they're having withdrawal symptoms, and they are actually continuing to smoke to prevent those withdrawal symptoms. Not that smoking is actually calming their nerves, because we know actually nicotine is a stimulant. It kind of revs you up. And so that is the really, I guess, heartbreaking thing, that, you know, some people that have anxiety or have mental health disorders, you know, will take on cigarettes thinking it will calm their nerves, when in reality, it really is the opposite effect. And we do know that, that tobacco use is much higher in the mental health populations. So, so I encourage all of you guys, you know, that I think formally, you know, substance abuse programs would say, oh, well, you know, let's treat their heroin addiction, but let's let them keep smoking. Well, what we found is that we have to address the tobacco use as well.
Mm-hmm. Thank you. I don't have any other questions. I don't see any other questions in the chat, but does anyone have any other questions? Give them a couple of minutes to see if they have any other questions.
Well, maybe when as people are thinking, you know, again, definitely would love to partner with all of you guys. I think there's so much partnership opportunities and collaboration. You know, I definitely think that COVID, you know, although in some way it seems like it's thwarted our efforts, you know, because really there was a lot of momentum, particularly in some of the over the mountain communities that were really, I think, seeing quite a high number of vaping, you know, in their high schools. You know, we really had a lot of momentum, and I know COVID has kind of prevented us at least from talking.
Yes.
But COVID, in a way, really makes this so much more important to address. Right. So I just want to thank everybody for their coming on and their interest in this topic.
Dr. Wally, this is Carrie Wimberly from Addiction Prevention Coalition. Just one question I had. We hear from lots of parents that their children tell them when the parents find the jewels or whatever, they tell them that these pods, that they are using pods that only have the flavored liquids with no other chemicals in there. So can you talk about that a little bit?
Yes, and I, Carrie, have also heard that so much. So thank you for bringing that up. What is really important for all of you to know on the call and all parents is there is no Juul product, none, that have no nicotine. And this is what Juul advertises themselves. They actually do have 2 levels of nicotine, a 59 milligram per milliliter and a 35 milligram per milliliter. But both of those are very high nicotine containing. And so, but, I think that, whether the child believes that there's nicotine or not, we definitely do have studies that, over half of kids that were using e-cigarettes said that they were using a nicotine-free product. But when we tested their bodies for nicotine, they all had nicotine in them. So no matter what product they're buying, and maybe the product is saying they have no nicotine, because as I've said, there's no regulation, or there's very little regulation at this point. But I did want to show you guys the Juul product. And I know it's a little bit too hard to see, but this says Juul and it says 5% strength. It doesn't say 5% nicotine. So to a 13-year-old looking at this product, they honestly don't know that there is nicotine in them. But again, just to reiterate, there's no Juul product that has no nicotine. All Juuls contain a very high level of nicotine. So great question, Carrie. Thanks for the clarification.
Okay, Dr. Wiley, on clarification on the previous question, they said, I guess what I was asking was if someone takes psychiatric medicine for anxiety or depression, what impacts it has on the effectiveness of the medication? Like if they vape or Juul, does it have an impact on the medication that they're taking for their?
Okay. Well, and one thing I didn't talk about that much is that because some of these e-cigarettes are what we call open system, you open it up and you put in your own liquid, we of course know that people are putting other things other than just, what they might even buy off the shelf. So, if you have a child, to this person's question, that, is saying that they're using e-cigarettes and you have a question about, whether that might be interfering or there might be, side effects, the problem is that you don't know exactly what they're vaping. But in terms of the nicotine, I think the main thing, of course, to note is that nicotine is a stimulant. So if your whole goal is that you want to, try to calm this person down, them using e-cigarettes and this nicotine is probably having the opposite effect.
Right.
So no easy answer, but I think, certainly asking what's in their e-cigarette and then, trying to get a sense of how much they're vaping, because if they're vaping 1 or 2 pods a day, that is a lot of nicotine, and that's a lot of exposure to a stimulant, and then they're probably addicted if they're using that much.
Thank you. Any other questions or comments? Don't see anything else. It was like, thanks, great information.
Well, and it would be great to hear from you guys, like Carrie said, or your audience, like what are they seeing? I went to a vape shop pretty recently, and they were completely sold out of Puff Bar, which is that advertisement that that I showed. But they had this, which you can see is so pretty. They had multiple other of these disposable e-cigarettes, and so it'd be great to maybe hear from your audience what they're seeing and what kids are doing in their communities.
Thank you. I don't see any other questions. Thank you so much, Dr. Wiley. Again, it was so much information, very important. And I learned so many new things. Like you said, you just don't know the different terminologies that they're using, because as a parent, you know, I have 3 girls and they are all adults. And so I did get past that 21, no one uses tobacco products. But the term dabbing, I thought was a dance.
Well, it is actually the football dance, but it's multi-meaning.
Yeah, so with parents thinking that, you know, their kids are talking about dabbing, they may think it's a dance, but they also need to check into whether they're vaping or juuling or what they're doing or how they're using that term, you know.
Absolutely. Good point there.
So again, some great information. Everyone, thank you for attending our webinar. Again, everything will be on our Facebook page, Addiction Prevention Correlation. We'll have all the contact information for Dr. Wiley, and she has access, you know, if you have any thing that you've seen as well, so, you know, let us know what's, you know, because like we need this information, we need this knowledge, because the way they use different slangs and terminology, and then if you don't know signs or symptoms, you know, looking at behavior models, you know, you wouldn't know. So this is definitely for parents to get information and know exactly what's going on. So did you have anything else, Dr. Wiley?
I think that covered it, guys. Thank you so much.
Thank you so much. Thank you again, everyone, for joining.